Dentists warn that one very common habit is quietly causing tooth loss in old age, and most people don't realize the damage until it's too late. Many seniors believe losing teeth is just a normal part of getting older. They blame age, weak teeth, or bad luck. But dentists around the world agree on something important. Tooth loss is not inevitable. In most cases, it's caused by long-term habits, especially one habit that slowly destroys the gums and bone that hold teeth in place. That habit is smoking and tobacco use. Smoking doesn't just stain teeth or cause bad breath. It attacks the foundation of your mouth. When you smoke, blood flow to the gums is reduced. This means less oxygen, fewer nutrients, and a weaker immune response. As a result, harmful bacteria thrive around the teeth, leading to gum disease. Gum disease, also called periodontal disease, is the #1 cause of tooth loss in older adults. It often starts quietly, with mild bleeding or swollen gums. There is usually no pain at first, so many people ignore it. Over time, the infection spreads deeper, destroying the bone and tissues that anchor teeth in place. Eventually, teeth become loose and fall out, or must be removed. Dentists consistently see that smokers and long-term tobacco users lose more teeth, and they lose them earlier. Studies show that older adults who smoke are far more likely to lose all their teeth compared to non-smokers. The damage builds up over decades, and by the time someone reaches their 60s or 70s, the effects become impossible to ignore. What makes smoking especially dangerous is that it hides the warning signs. Smokers often bleed less from their gums, not because their gums are healthy, but because blood flow is restricted. This means gum disease can become severe before it's noticed. Smoking also slows healing. Even if a smoker visits the dentist, treatments for gum disease are less effective, and recovery takes longer. Dental implants are more likely to fail, and infections are harder to control. But smoking is not the only habit contributing to tooth loss in old age. Dentists warn that several common behaviors can work together and speed up the damage. One major issue is brushing too hard. Many people believe brushing aggressively will clean better. In reality, hard brushing wears away enamel and pushes gums downward. Over time, this causes gum recession, exposing the sensitive roots of teeth. Exposed roots decay faster and are more likely to break or loosen. Another overlooked problem is dry mouth, which becomes more common with age. Many medications for blood pressure, diabetes, depression, allergies, and heart conditions reduce saliva. Saliva is essential because it washes away bacteria and neutralizes harmful acids. Without enough saliva, teeth decay faster, and gum disease progresses more rapidly. Teeth grinding, known as bruxism, is another hidden danger. Some people grind their teeth at night without realizing it. Over years, grinding wears teeth down, causes fractures, and puts excessive pressure on the jawbone. In weakened mouths, this pressure can lead to loose teeth and eventual loss. The good news is that tooth loss is largely preventable, even later in life. Dentists agree that the single most powerful step is quitting smoking. When someone stops smoking, blood flow to the gums improves, inflammation decreases, and the body becomes better at fighting infection. While past damage can't always be reversed, quitting dramatically slows further destruction and improves the success of dental treatments. Gentle oral care also makes a huge difference. Dentists recommend using a soft, bristled toothbrush and brushing with light pressure. Let the toothbrush do the work. Brushing twice a day for 2 minutes is enough. Scrubbing harder only causes harm. Managing dry mouth is critical. Drinking water regularly, chewing sugar-free gum, and using saliva substitutes can protect teeth. Anyone experiencing constant dryness should talk to their dentist or doctor, especially if they take multiple medications. Regular dental visits are essential, even if there is no pain. Gum disease is often painless until it becomes severe. Professional cleanings, early detection, and proper treatment can save teeth that might otherwise be lost. For those who grind their teeth, a dentist can recommend a night guard or other treatments to reduce damage and protect remaining teeth. The most important message dentists want older adults to hear is this: losing teeth is not a normal part of aging. It's usually the result of long-term habits, especially smoking, combined with neglect of gum health. Protecting your teeth means protecting your gums, your bone, and your overall health. Small changes today can preserve your smile for years to come. If you or someone you care about is getting older, take this warning seriously. Break the habits that destroy teeth silently, because once teeth are gone, they don't grow back.